at least 84 million people will die in the next 10 years. Last year, nearly 8 million people died because of cancer, and at least half of it is avoidable, and that is why we think we have to pay more attention to it. Cancer, being a very complicated disease, obviously affects them more harshly. There are also cancers in developing countries that are caused not because of aging of population, but because of viruses and environmental issues and problems. And it is estimated that they most probably will suffer more, and probably in the next 10-15 years, over 70% of cancers will be in developing countries. Well, agency has been involved for many years in the area of radiotherapy and cancer therapy, as well as nuclear medicine. These are areas where radiation is used, and we have a very good experience. We have very good technical expertise, and we have a good delivery program through technical cooperation. PACT was created in 2004, or approved by the member states in 2004, and it became operational in 2005 based on what I said earlier on, the increase in the incidence of cancer in developing countries and the expected increase, of course, in number of cancer cases in the next 10-20 years, and the importance and the role that radiotherapy plays in the overall treatment of cancer. It would have 4 areas or 5 areas where our attention must be paid. The basic and probably most important in the case of cancer, like many other diseases, is prevention. Then the second major component of a cancer control program is related to early detection and screening of the cancer patients. The third one is to do with the diagnosis of disease and treatment. And the last one, that we normally call palliative care, is the end-of-life care. I would add also probably additional component related to the capacity building and training and education required. Of course, it requires in all areas, but it must be also treated as an area where attention must be paid, because in most developing countries what is really short is the availability of professionals to help with the implementation of such systems. IAEA alone cannot deal with this. This is no way that we only focus on treatment and hope to be successful. We need others who have major roles, especially WHO, that in setting the health policies and helping developing countries plan their healthcare systems and introduce cancer care as part of an overall healthcare system. And there are, of course, many other international organizations who are active. They are NGOs and they are UN-related or national organizations, where they could support any of the components of the cancer care program in prevention or detection or introducing screening programs. And without their help, we cannot, of course, continue our work or be successful. The first step in establishing the PACT pilot projects is to bring the stakeholders at the level of the country together, look at the problem, and bring also expertise from other organizations beyond IAEA to help them to develop the plans at the national level based on the resources that is available to them or expected to be available, and prioritize the activities. Currently, we have 6 pilot projects. In Africa, we are focusing on Tanzania. Then we have in Asia 3 countries, Yemen, Sri Lanka, and Vietnam. And then in Europe, we work with Albania, and in Latin America with Nicaragua. These projects and countries were selected based on the relations we have with WHO. WHO has, as you know, 6 regional offices, so it's corresponding to each of the regional offices, so it enables them to participate. This is important also from the within the context of relations with WHO and their interest, and also the support that we need for those countries. In the short term, probably placing cancer on a global health agenda and drawing at the attention of the donors and governments and other organizations and the public at large, to just everyone would understand that this is a growing disease, this is a major epidemic, it is not something that we can just forget about. Maybe another challenge would be to inform the population themselves that this also a cancer diagnosis is not a death sentence. This is really, as I said, a type of disease that is curable. There are technologies, techniques, and medicine available. It may be somewhat expensive in the short term, and that is why the funding obviously is important. But in the long run, is a cost-effective treatment available for it.